Hi everyone, I hope you all are doing well, and this is Dr. Grace here. Today's video is about anxiety and panic attacks. If you or any of your loved ones are dealing with anxiety or panic attacks, this is a must watch video for you. In this video, I'm in conversation with Dr. Avinash DeSousa, who is a psychiatrist based in Mumbai. He is someone with 25 years' experience in the teaching space as well as in clinical practice. And in this video, I have asked him some very specific questions related to anxiety and panic attack. I believe these are questions that often run through the minds of people suffering from anxiety and panic attacks. And if you watch this video till the end, I'm convinced you'll have a lot of clarity on your situation and you'll also have hope that recovery is possible. So let's get started. Hi, Dr. Avinash. Thank you so much for giving us your time today. And I'll just get started with the question. So first of all, in in your current practice, what is the total number of patients or the percentage of patients that you see today who are dealing with anxiety or anxiety
Well,
disorder?
okay. So I think, see, anxiety is very common in the general population also. So one in five people are anxious. And we see a lot of people who come to us with anxiety related issues. So if you ask me, around 30 to 40% of patients that visit my clinic have an anxiety related problem. So it is that common. So in a day, I may see around 5 to 10 patients that have an anxiety issue, maybe different forms of anxiety, but anxiety is definitely there.
That's a very, very large number. And have you seen any change since the past 10 to 15 years, an increase in this number, or it's been the same, more or less?
See, I think one major factor that has raised anxiety by leaps and bounds was COVID. And
Okay.
so in COVID, everybody was anxious about survival, about
Absolutely.
finances, about multiple things. So anxiety rose at all sectors. People were not sure whether they would be, many people were working from home and then lost their jobs, multiple things. So anxiety was always there. And at least initially, they didn't know whether the pandemic would consume everybody, whether they would survive, what would happen. But then slowly only, I think once the second wave got under control and people realized that okay, this is treatable, there are medications, there are others, so people got a sense that okay, we can manage COVID, there is no problem.
Hmm.
I think what also matters is that today's generation, today's lifestyle is such that we want instant gratification.
Hmm.
We want, we do not have the ability to wait.
To wait.
So if someone tells you that wait a few days, it gives you anxiety. If someone doesn't reply immediately, it gives you anxiety.
Hmm.
Sometimes you send somebody, it's as small as sending somebody a message on WhatsApp, and
Hmm.
that person has seen but is not replied.
Even
Maybe
that
it's doing
causes.
something else. Yeah, that can cause anxiety. If people don't get likes on their social media, it causes anxiety. So anything can cause anxiety. So it's there, it's increasing day by day, because I think we've become more in this fast paced world. Our needs have become, our need for recognition, our need for approval from others is so much that it causes a lot of anxiety.
Okay. So as a lay person, when I start experiencing feelings of anxiety or I get a panic attack or, I just feel I'm feeling too fearful. What is it that I should do first? Whom should I go to? Should I be going to a psychiatrist or to a counselor or to my general physician? What is the
Yeah,
first
so
step that I should take?
it depends on multiple factors. So if people are getting more of physical symptoms, they generally end up going to their general physician first, who
Okay.
would then refer them to a psychiatrist or a counselor. But if someone is worried about the house, finances, employment, and it's more of a worry and a more psychological, cognitive kind of symptoms, then they very often say, okay, let me go to a counselor. I always tell everyone go to a counselor first, because there
Okay.
is still a lot of fear and stigma related to meeting a psychiatrist
Meeting a
directly, and
psychiatrist.
they often feel I'm not so severely ill that I need to see a psychiatrist. So they say, okay, let me, counselor will only talk to me, she can't prescribe, she can't do anything, so it's fine, I'll go and meet. And then when the counselor feels no, you need medication, see, but anxiety patients are a little open to medication, because
Okay.
the anxiety symptoms are so distressing
They are. Yeah.
that they don't mind taking one pill to calm
Yourself feel
themselves down.
better.
So they say, they say we may not take regular medication, but give us some medication which we carry with us, or we take it as an as and when basis, so that if we have anxiety, we put it under the tongue, it will help
Hmm.
us calm down. Or just one tablet at night they are ready to take if they are getting a
Hmm.
night anxiety attacks. So they're very happy. So that at least that way they are a little open to the idea that they understand, because there is palpitations, there is sweating, all those symptoms are there. So they think yes, some medical help is needed. And what happens with anxiety also, when anyone feels very anxious, sometimes they get a little bit of chest pain. So
Hmm.
then they begin to feel, oh, am I getting a heart attack? Is
Something's
it
wrong
going to
with the
be?
heart.
They
Yeah.
definitely rush to a doctor at least, if nothing else, who
Right.
will do an ECG, check them up, and tell them, no, no, you're only anxious. There is nothing wrong with you. So
Hmm.
at least that happens.
Hmm. Right. So that means if people come to you with when they come to you with symptoms of anxiety, from what you're telling me, I gather that not everybody needs to be put on medication. So you would
Not
take
at
a
all.
history, understand, and then decide whether this person needs medication or lifestyle changes and counseling can help the person. Correct?
Yes, yes.
Okay, and now one question which I think all your patients, when you give them a prescription, they would be asking you this, and I'm going to ask you on behalf of all of them. So, when somebody is put on a medication for anxiety, does it have to be taken lifelong?
Okay, so the answer here is that uh, anxiety is treatable, it is curable. uh, we normally suggest a multi-pronged approach. So we tell patients that you take medication also and therapy also. But patients generally find relief with the medicine, so then they don't go for therapy. Or and there are some patients who go for therapy but are irregular. So I always tell patients that if you do both properly, there will come a time where therapy will help you heal and we can get you off
The
the
medication.
medication also. But what happens is that uh, patients who take medication sometimes develop what I call a psychological dependence on the medication. It's like someone who takes a laxative. They keep feeling that, oh, if I today I forgot my laxative, no, I think tomorrow I will not be able to have a good motion. But what happens is, if they've forgotten and they don't remember that they have not taken it, sometimes everything is fine, nothing goes wrong. But sometimes if they suddenly remember at 4 a.m., oh, I had not taken, then they'll get worked up about 7 a.m., that no, things are not going to happen. So
Hmm.
then even if their bowels would have otherwise normally functioned, it
Hmm.
doesn't function.
Hmm.
So same goes with anxiety. A lot of people feel that, I'm taking that pill, I'm fine, I don't want to get off the pill. It's a
Hmm.
psychological dependence, and they feel, oh, now the pill is stopped, I'll get a panic attack. So, and they get an attack. So one of the things which I tell people is good therapy is very important in anxiety. So you need to look at the root cause.
Okay.
Where is this stemming from? Is it stemming from childhood? Is it stemming from other insecurities? Is it stemming from psychological factors? So that needs to be corrected.
Okay.
Once you correct that aspect, then I think anxiety severity intensity reduces and it can be managed without medication.
Medication.
There are also some patients who have anxiety as a personality trait. So they are anxious in general. So
Okay.
anything, I mean, husband is late by half an hour, maybe he's stuck in traffic, they'll get anxious. Oh, what has happened? Children had to come by 4 o'clock, it's 4:30, they'll get anxious. What has happened?
Mm-hmm.
Check was to come in the bank, it's delayed by one day, they'll get anxious. So everything makes them
It's a
anxious.
trigger, basically.
Yeah.
Right.
So, but lifelong medication is not needed. I will categorically say it is not
Okay.
needed. I
Okay.
mean, it can be stopped. Maybe for a few years you will need medication, but it can definitely be stopped.
Okay, because often I've seen people have that resistance that, oh, once I get on it, I will be dependent on it, or I'll always have to take it lifelong. So I don't want to start. And then they end up suffering or just, bearing with the symptoms because they have these misconceptions.
Now,
So,
I will make one point here that
yeah.
the dependence is psychological.
Okay.
See, it's
Okay.
it's not that they are, I start somebody on, say, 1 milligram of a tablet.
Hmm.
The dependence becomes physical when the person starts taking 2 mg, 3 mg, 4 mg on his own.
That's
That doesn't
important.
happen here. They are taking the same dose, but
Okay.
the dependence is psychological. Ki if
If
like
I
in
don't
Hindi they
take
say,
it, I'll lose
मैंने
you.
नहीं लिया तो क्या होगा? What will happen if I don't take it? What will happen? So that dependence is more in the mind. It's not that the body is dependent on it. It's the mind that is dependent.
That's
Now
very
that I have taken it,
important.
nothing will happen to me. That kind of thing.
Okay. And in terms of when we look at treatment in terms of time, let's say I start experiencing symptoms of anxiety and I immediately, recognize it and I seek help. will it mean that my recovery will be sooner, as against I have been having anxiety since 5 years and I'm too scared to go take treatment, I'm embarrassed or whatever, I just don't want to take treatment. So if I've had it for a longer time and I wait till I start treatment, will it mean that my recovery will also take longer, or I'm asking in the context of
See,
time?
in any illness, I always say in any illness, medical, psychiatric, the earlier you detect, the earlier you treat, it's better.
Better it is.
So if I leave anxiety untreated and I try and manage, now obviously in 5 years its roots deepen. So then for me to recover takes longer.
Okay.
So it is even with depression. I mean, if I feel depressed for 1 month, I go and seek help, I recover much faster. But if I wait for 5 years,
Hmm.
then the depression has already done so much harm that trying to, and the same goes for even diabetes. So let's say if I detect my sugar is high, I go in
Yes.
1 month, it can be rectified. But if I wait 5 years,
Yes.
there are other complications that have also come up. So all those issues are there.
The sooner you start taking
The sooner
treatment,
you
the better.
better. It's always better. Earlier, early detection, early treatment, always better.
Okay. Okay. Now, when it comes to anxiety, like you just mentioned, it produces a lot of physical symptoms, and sometimes every day can be a different story. One day palpitation, some day nausea, some day dizziness. So, is there a way for the person to know that these physical symptoms are being caused by anxiety? Because otherwise, very often I've seen they go into this loop of health anxiety, then thinking that, maybe this is something serious and it's not being caused by anxiety. So, is there a way for them to know that yes, these symptoms are caused by anxiety? It's not an organic cause, or what should they do? What should be the approach for all the
See,
physical
generally,
symptoms?
generally, most patients get an ECG done or they visit
Okay.
a physician.
Okay.
So their 2D echo for the heart, all those things are done. Some
Okay.
of them get an MRI done for the brain. Some of them feel
These are ruled
acidity. So
out.
then they go to a gastroenterologist. They get an endoscopy done. So generally, by the time they come to us, the file is
All
full of
this is
physical
done.
investigation. So then we know that everything is ruled out, anyway. And
Okay.
they are getting blood tests done, which are all normal. So,
Okay.
thyroid is normal, everything. We are ruling out everything. And then finally, all the doctors tell them, Ki, now, see, this is all psychological. You need to go and seek help from a psychiatrist. So by the time they come to us, it is all ruled out. So generally, physicians always rule out. So, like I always say, anybody who comes to us with symptoms that depict anxiety, we do a basic ECG at least. So we see that there's no heart issue. We also
Get
do a
all
2D
that
echo
ruled
about
out.
the age of 45 to see that the heart is fine. Then we may do a large number of blood tests to rule out anything medical that could be a cause.
Okay.
So once we do that, it's only then that we start with anti-anxiety medication.
Okay.
So generally we always rule out, but uh, the one way to distinguish is that, see, you would also have other physical symptoms if you had a medical problem.
True.
You would not
Yes.
only have these anxiety related symptoms.
Yes. Yes.
So, and if
Correct.
your investigations are all normal, then where is
Normal,
the
yeah.
issue of having a medical problem?
Correct. Correct. Now, Dr. Avinash, we'd like to talk a little bit about panic attacks. What are panic attacks? And if a person is having panic attacks, how does it relate to the anxiety? Does it mean that I'm having severe anxiety if I'm having panic attacks? Or can I have bad anxiety even if I'm not getting panic attacks? What are they? Can you talk a little bit about this?
Okay, so a panic attack basically is an attack. It's like an anxiety attack. What happens is I develop palpitations and my heartbeat increases, right, from 80 beats per minute to 100, 200. It goes fast, and I feel my heart thudding. So they say chhati mein dhad dhad hota hai. So you feel that thing.
Mhm.
Then they start trembling, there is sweating, they feel breathless, they feel the chest pain, they feel dizzy, they feel blackening, blackout before the eyes. So they feel they're going to now fall down or become unconscious. So they begin to feel that way. So those are the physical symptoms, and this reaches a peak in around 5-10 minutes. So, before you know anything, it has reached its peak.
Mm.
Generally, it subsides also in around half an hour. It
Okay.
doesn't, but
Mm.
in that peak, obviously, they are rushed to a casualty department or emergency department that, something is happening
Something is happening.
and whatever. So that is all sort of done.
Mm.
But once the patient realizes, this happens 3-4 times and the doctors tell him, no, this is a panic attack, you have no problem. Then he realizes now these are panic attacks. So the main worry is after one attack subsides, patients keep developing a fear
And
of what if a
fear of
second
the next
attack comes.
one.
what we call anticipatory anxiety. What is going to happen now. So that is the biggest thing. I shouldn't get another attack. That's the worry. So then based on that, then we look at medication. Now panic attacks also could have multiple symptoms, as you said. Every time the symptoms could be different. It could also be the same. There are some patients who develop panic attacks, like they'll say it only comes in the afternoon when I'm alone, or it only comes in the evening. So there is related to a particular time.
Okay.
Sometimes it could just happen anytime. And there are some patients who say, no, it comes before I have a presentation in the office, or before I have end of my appraisal happens every month. So 1 week before that the attack starts. So there's some trigger.
So there's a
Some
common
people get it
trigger.
only in the night. So they go to sleep and then they get up at 3 a.m. with a panic attack. So that
Okay.
can
Okay.
also happen.
Okay. So one of the another thing that I asked you was that does it mean that if I'm having panic attacks, my anxiety is severe, or there's no really any such correlation? Because sometimes I've seen some people they have a lot of physical symptoms of anxiety, or they are constantly these jittery personalities, but they don't have panic attacks coming. So is there any such
So panic
correlation?
attacks are one way of manifesting the anxiety.
Okay,
you
as
know
simple as
it's like if I have blood pressure, I could have heart disease, which is caused by the blood pressure. If I have blood pressure, I could have stroke, which is caused by the blood pressure. I could have. So panic attacks is one way of manifesting of the anxiety. It doesn't mean everybody could have it. There are people who are panicky but may not have a panic attack.
panic attack. Okay.
There are some that have a panic attack. And see, there are some patients who have panic attack thrice a week. There
Mm-hmm.
are some patients who have panic attack thrice a year. So
Okay.
it could vary. So that variation is also there. So it
Okay.
all depends on what is the level of anxiety. Sometimes, uh, you know, it can happen that the person had anxiety, was treated, was absolutely fine.
Hmm.
They were fine for 6 months, no symptoms. They went to a mall, suddenly saw ex-boyfriend, ex-girlfriend, and they had a panic attack because all the memories come back, or whatever. So
Hmm.
that can also sometimes can happen, and then out of the blue they'll say everything was fine. Why did I get a panic attack? And they'll say,
Okay.
no, the moment I saw that person, I got anxious and it just happened.
Okay. Okay.
So that can also happen. So you may not have the frequency, intensity could also vary.
Okay. Okay.
Yeah.
Understood. Got it. So now there is panic attacks is a very widely searched topic, and I have picked up 5 questions, which are the top 5 most searched questions on panic attacks, and I want you to answer those. First thing is, can a panic attack last for several days?
No, generally panic attacks last for around maximum half an hour to 40 minutes.
Okay.
But
Okay.
anxiety can last for several days. So
Given
in
when it
between,
is
he may
severe.
continue to be anxious.
Okay.
So he may say it's been 4 days, I'm feeling anxious. That can be there.
So he's
So
probably having repeated panic attacks, and between the
in
panic
the
attacks,
middle, so he may have 3-4 times a day panic attacks followed by anxiety, which is constant.
okay, got it. Can a panic attack cause a seizure?
If the person is epileptic already,
Okay,
then
already.
there may be a chance that the panic attack could trigger a seizure. But generally, panic attacks on their own never cause epilepsy.
Okay. Can a panic
But
attack
if it's an
cause,
epileptic patient who's already epileptic,
there's
we
a
have to be careful.
likelihood. We have to be
Yeah.
careful. Okay. Can a panic attack lead to death? Can it kill you?
Well, now again, the corollary here is if I have somebody who has a very weak heart
Hmm.
and the panic attack, causes the heart to beat very fast, or there's a
Hmm.
problem.
Hmm.
Then in those cases, certain complications can arise. But
Okay.
in people like you and me and others who have a normal heart otherwise,
Hmm.
the chances that a panic attack will cause death is absolutely next to nil.
Okay. Okay. Can a panic attack cause a heart attack?
Chances are very less because the symptoms overlap, but the
Okay.
mechanism of by which a panic attack is caused and by which a heart attack is caused is different. So
Okay.
heart attack is caused when blood supply to the heart muscles stop because your coronary arteries, which are the blood supply to the heart, they are blocked.
Hmm.
So whereas a panic attack comes because adrenaline rises, when
Hmm.
you're stressed. So the mechanisms are entirely different. So it is not that panic attack could cause a heart attack. No, that may not happen.
Okay. Can a panic attack occur during sleep?
Yes, it can definitely occur during sleep. So those are what we refer to as nocturnal panic attacks that occur only in the night. So it can sometimes you see a dream which is anxiety provoking, and that can trigger a panic attack, and you wake up. Sometimes you can just wake up to probably go to the bathroom or drink water, and it could trigger a panic attack. It can happen in the night. It's well known.
Okay, okay. I think from all these questions, it's quite evident that it's a lot of fear that people have about panic attacks and the fact that, they're either going to pass out or it's going to kill them or it's going to damage their heart, which is why everybody's out there searching these questions on Google. And I think your answers should.
See, anybody who's had one panic attack in their life, is in constant fear that it shouldn't happen again.
Agree.
That is how, because at that time, you feel that you're going to die. That's the
Mm.
thought.
Yes,
That's the feeling. It's like, I'm going to pass out. I'm going to die. I think I'm going to collapse.
yes.
You know, I'm not going to make it even till the door. That is a kind of
Mhm.
feeling. So the thing is, they don't want to undergo or experience that feeling again.
Yes, I understand. Yes, yes. So, in your experience, what are some of the common physical or physiological triggers of anxiety? Because, of course, we know about stress and, like we said, temperaments or the way, childhood trauma and stuff like that. But let's talk a little bit about the physical triggers, things like hormones or lack of sleep or, maybe some nutritional deficiencies. What are the common triggers, the physical ones?
So I think one is a lack of sleep is the first trigger.
Mm.
Sometimes even if you have high blood pressure, that could be a trigger. uh, Anxiety could be genetic, so that is there. Apart from that, if there are hormonal changes that are having, so in the premenstrual phase, premenstrual period also, sometimes this can happen. Pregnancy could cause some amount of anxiety at times, and thyroid problems could
Okay.
also cause anxiety, and cancer as a diagnosis could cause anxiety. So there are multiple illnesses. So it's like I always say, cancer, TB, HIV. I mean, the moment you tell anyone that you have these problems, it's going to trigger anxiety.
Mm-hmm. Okay, got it. Now, in your experience, what are the three common life situations? You've already actually answered this question, but I still want to ask you again, three or four, five, whatever you can tell us, the common ones that could trigger anxiety, where you have a lot of
Yes.
patients coming in with these life situations where it has put them in
So
anxiety cycle.
one is a breakup or a relationship failing.
Okay,
Second is death of a loved one.
okay,
So death of spouse, girlfriend, mother, father, somebody you're close to, close friend.
okay.
So that is it. Third, suddenly losing a job.
Oh,
Yes.
okay,
Four, financial stress.
okay,
And fifth, which can also happen, is if sometimes anxiety can also be provoked if there are workplace related stress, for that matter, or if there is uh, arguments at home, the whole home environment isn't very peaceful. So these are also things that could trigger.
okay,
And
okay.
excessive caffeine use,
Oh, really?
excessive energy drink consumption,
Okay.
these things can also cause anxiety.
Okay, okay. So apart from the the medication, what are the non-medication based treatments or just lifestyle changes or therapies that you think are quite powerful and effective?
So we always tell patients to opt for yoga and meditation first. That's something which is very, very useful.
Okay,
Second, we tell them exercise on a regular basis. So walk,
okay,
uh, gymming, anything that they like to do.
okay,
Third, we tell them avoid caffeine after 6 p.m. Avoid large amounts of caffeine during the day. Avoid situations like a closed lift, overcrowded train. I mean, anything that you feel could trigger your anxiety. So that is something which,
mm,
getting good sleep and good sleep hygiene, that you sleep well for around 7 hours,
mm,
is very essential.
mm,
And also, for that matter, avoiding situations that could trigger, so toxicity, toxic relationships, toxic people around you.
mm,
Avoiding those things could be a big factor in causing anxiety.
mm, mm. Okay. And now these days there is, and rightly so, there is a lot of talk about childhood trauma, a lot of recognition about childhood trauma or past trauma, and how it is shaping the way you are as an adult. And a lot of times there are certain anxiety experts who say that anxiety always has its root in childhood trauma. There are a lot of people who also counter this. I would like to know, what do you think about this? That, everybody who is having anxiety as an adult, would you say that it can be traced to childhood trauma?
At least 30 to 40% of patients who have anxiety as an adult have had some childhood event that has upset them.
Okay.
The event could be traumatic, may not be traumatic, but there's been something that's happened, of course.
Okay.
Childhood trauma definitely causes anxiety because it's something that is not treated at that time.
Okay.
It's just left and it keeps resurfacing from time to time.
Hmm.
So it can cause anxiety and it may resurface in the form of a panic attack sometimes. So it can happen.
Okay.
So, for example, if you've had somebody who's had child abuse and has been abused by a relative, now after many years, say they see that relative in a function somewhere, it can trigger a panic attack. Same way, bullying that you had in school or college can cause anxiety. Always
Okay.
because of low self-esteem. A harsh boss may be
Hmm.
thought of as a bullier,
Hmm.
and the bully comes back into your life again, and that can trigger anxiety again.
Hmm. Hmm. Got it. Got it. So when you're treating someone with anxiety, you may have seen that there are some people whom you are able to wean them off the medication sooner. They progress better. They do not have as many relapses. And there may be a certain set of people who you find that it's difficult for, they take longer to wean off medication. They probably need higher doses, or they have higher chances of relapses. What is the difference in these two groups of people in terms of their temperament, their approach to their illness, the support that they have in general? What is different, so that the ones who are taking longer, they could learn from this and make those changes?
So the ones that recover faster, A, are the ones who are more resilient in general.
Okay.
Second, they also have better social support and better family support.
Mm. Okay.
At the same time, they also are more compliant and regular with their treatment.
Okay. Okay. That makes a
Or
difference.
you incorporated also positive lifestyle changes like yoga, relaxation, sleep hygiene,
Okay.
multiple things. So
Okay.
if they're following everything to the toe, they're bound to recover faster.
Okay. Okay. All right. So again, this is a question you asked answered already, but I'm still going to ask you. In the times that we are living in, everybody goes on to Google to look for solutions. And when it comes to anxiety, also, if you go onto Google and you type, can anxiety be cured, or how do you treat anxiety? How do you cure anxiety? The results, the search results tell you that on the first page itself, that anxiety cannot be cured in bold. It can be treated or managed. And I think this is the last thing that I want to ask you before we conclude this, that would you also say that, because everything you read on Google is not correct, but yet it can be very discouraging for somebody when they go onto Google and there's the first thing they are told that, lifelong you have to manage it. It's part of who you are now. So can it be cured, or does it always have to be managed?
No, no, it can definitely be cured. There is no doubt on that front. But there are some people who have anxiety as a part of their personality. So
Hmm.
then, it continues then for life because it's part of you. It doesn't
Hmm.
change. But we can help you mitigate it, manage it, be the intensity and severity can be reduced to such an extent that you don't have a problem. So then it's fine.
Okay. So this is us. What percentage of patients would you say is this who has it as a personality trait?
Around 20 to 30%.
20 to 30% of the total number of people who have
Total number of
anxiety.
patients with anxiety. Yeah. Yeah.
Okay. Okay. All right, Dr. Avinash, thank you so much. This
Thank
has
you so
been
much.
really nice. Thank you so much.
Thank you. Thank you so much. Yeah.